Good afternoon. Hi, my name is Paul Gross. I'm the president and CEO of the Cerebral Palsy Research Network. I'm really excited to talk to you this afternoon about how one can build a registry, in particular our CP registry, from usual care by enabling your electronic medical record system to support research and quality. So let me give you a little background beyond my introduction that will set context for this. I am a high-tech person. I spent 25 years of my career running software development teams or running businesses around software development. And I have a 18-year-old son who has both cerebral palsy and hydrocephalus that's really had a sort of a very big impact on the latter half of my career. And as a function of that, I ended up getting involved in accelerating research for neurological conditions, in particular his two conditions, first by getting involved with his hospital, Seattle Children's, then joining the board of the largest foundation that works on supporting hydrocephalus. And eventually that led to an appointment to the advisory council for the National Institute of Neurological Disorders and Stroke. And as a function of his condition, I ended up co-founding 3 clinical research networks and 1 discovery science network. So this story is going to be a bit interwoven with my personal story. So my son, William, our second child, was born prematurely, and he was really the instigation of all of this sort of change in the way research was being done. He had a pulmonary hemorrhage at day 2. This is a picture of him before he had the pulmonary hemorrhage, and they really threw the preemie book at him. So he had a medical neck, he had lots of things. The key issue was he had a bilateral grade 3 intraventricular hemorrhage, which really caused the major neurological complications in his life. He was temporarily shunted at 32 weeks and then permanently shunted and discharged from the hospital at 39 weeks. So at the time, there was not a lot known, or there were a lot of unknowns about hydrocephalus. There had only been a few clinical trials. The shunt had been invented by a dad who was an engineer in the 50s. The diagnostic method was radiating and very often resulted in exploratory brain surgery, for which there was a pretty high risk of infection, which could be pretty devastating. So by the time my son was 6 years old, he had had 5 brain surgeries, 3 of which were emergencies, 2 of which turned out to be exploratory. And he had had 23 CT scans of his brain and countless visits to the emergency room. So my wife and I, as sort of type A parents, engaged in the field of hydrocephalus. This was spurred by the fact that our neurosurgeon came into our son's room before he had the shunt placed and said, I thought of what I was going to do in the shower and for how he was going to select a shunt. And that struck us as not having enough evidence behind us. So we elbowed our way into what turned out to be the first NIH meeting on hydrocephalus in 2005, just 9 months after he was born. We read all of the evidence. There was not that much. And then we determined to sort of alter our life so we could fund some research and try to make a difference. I sought out a team of executive MBAs at the University of Washington to help me write a strategic plan for what to do with some money and some time. And so we basically boiled the ocean and we came up with a plan. And in June of 2006, started executing on that plan, kickstarted some basic science research at Seattle Children's. I joined the board of the Hydrocephalus Association and drove them sort of towards a research program. And I partnered with the leading trialist that had run those few clinical trials that had happened at the NIH meeting. I met him, actually insulted him, but then formed a great partnership with him. So that is John Kessel, who I co-founded the Hydrocephalus Clinical Research Network with in 2006. We launched with just 3 sites. I focused my time on raising startup funding, while the team focused their efforts on defining a registry that would both characterize the patients with hydrocephalus and the surgical events that they went through. And the model was one of using clinical research assistants to do chart abstraction from the EMR. So the per site cost for those 3 sites was $75,000 to over $100,000 per year for a full-time clinical research assistant. Now, that research assistant didn't just do the registry, they also were available to support pilot studies. So if you fast forward to today, the Hydrocephalus Clinical Research Network is 14 sites across North America, and then it's shadowed by a 34-site quality network that implements the quality improvement efforts that they do. It's received public funding from NIH and PCORI, and then recently with a very large trial from NIH again. And they have a registry at their core with over 7,800 patients and over 18,000 surgical events. The biggest thing they did was their first study, which was a quality improvement effort, which reduced the post-surgical infection rate by 35%. That was their initial big impact. Since then, they've gone on to write over 20 papers. They've done innumerable presentations, and they're continuously improving outcomes for people with hydrocephalus and raising the bar for research. So how does that relate to cerebral palsy? Well, my wife and I were quite focused on my son's hydrocephalus with that sort of early trauma that we went through. He had a fairly typical late diagnosis, 2-year diagnosis of CP with spastic diplegia. And so we went through lots of therapy, orthotics, durable medical equipment. But it really culminated in a gait study that we did at Shriners in Portland in 2012, where the orthopedic surgeon sat us down afterwards and said, well, your son either needs a selective dorsal rhizotomy, so a very invasive neurosurgery, or a single event multi-level surgery to improve his gait. And both of which were, significant surgeries, a year of physical therapy to recover from. And they said, you need to decide this. And so my wife and I looked at each other and started round 2 of type A parent engages in research. So we read all of the evidence. It was pretty clear that both of the interventions were efficacious, but nothing compared them. And so we really felt at a loss, and we were really determined to generate more evidence. So my wife said, I think you need to do for CP what you've done for hydrocephalus. And from my perch on the NINDS Council, I was able to organize instigate the organization of a CP workshop. So that NIH workshop happened in late 2014, and it was very different than other NIH meetings in that the organizers stood up in the front of the room at the end and they assigned to people that were participants in the meeting to run a task force to try to advance these 5 things of creating a national CP registry. And I was appointed to that task force with Deb Gabler, a physical medicine doc from Shirley Ryan Ability Lab. There were other assignments for getting more comparative effectiveness research to happen, increasing the study of adults, growing the field, and advancing basic and translational science. The CP Research Network was really founded to do those 4. So my effort to create a national registry really expanded into really addressing the rest of those elements. And it was really the merger of my experience with the Hydrocephalus Clinical Research Network and Dr. Gary Noritz's experience at Nationwide Children's, where they had a single center registry for CP that I learned about from him at this meeting that was based on their EMR. And they had every clinician that saw kids with CP was using a form for their usual care, but capturing discrete data. And that became the North Star of what became the CP Research Network. And then both me and my co-founder, being parents of children with CP, we were definitely focused on being patient-centered from the very outset. So the CP Research Network was formed in 2015, and its mission is to optimize the lifelong health and wellness of people with CP and their families through high-quality research, through education, and community programs. So the CP Research Network is a 501c3 nonprofit that really just tries to organize the field of institutions, clinicians that treat people with CP, therapists, researchers, and patient advocates, all to improve outcomes for people with CP. Physically, we have a data coordinating center that's hosted at the University of Pittsburgh, where both our community and our clinical registries sit, and then we have our education and well-being programs. So from 2015, we've made a lot of progress. So we launched that clinical registry in March of 2016, just 15 months after we started the network, 15 months after that meeting, that NIH meeting. And it now has more than 7,500 patients in it. And we launched a community registry that has about 1,700 people in it, where we get information about patient-reported outcomes. We put together a PCORI-funded effort to set a patient-centered research agenda called Research CP, which we published in 2018. And then we went on to get significant funding from both NIH for a genetic study and made a partnership with the largest private funder for CP research just a few months ago. We have 4 active quality improvement efforts in the network. And then we've had 9 publications, more than 27 academic presentations, and 5 manuscripts under development. So those were our key accomplishments in that research and quality area. So the way the data is populated is an important part of this story. So what we've done is, based off of the experience with Nationwide, is we work with the sites to determine their clinical workflow and then make sure that for the elements that we want to capture in the registry, all of which are elements of usual care, they can be filled in either from a smart list or from a form. So a clinician clicks on a link in their note and it opens up a form, and then they click. And what happens is discrete CP related data is stored in a discrete fashion in the EMR, which can then be extracted. So the data is collected in the same way across all of our centers. We do also offer something similar to what the HCRN did, which is at some sites, we have a clinical research assistant that does chart abstraction into a REDCap set of forms that sort of mirror what we capture in the clinical care forms in the EMR. And they either do that on the full patient population or on a subset. Like, we have a number of neurosurgeons that are involved because of my history with hydrocephalus that are wanting to study the neurosurgical interventions. And then again, that data is all going into REDCap at the University of Pittsburgh, so it gets put into the registry. And then the community registry works off of our website, where people can sign up for what's called MyCP, and then they get presented with surveys that are more community oriented about things that are happening outside of the clinic. And they can then take those, and those are implemented in REDCap as well. They also get emails for those surveys, and it just targets them for the surveys that make sense about their CP. So to give you an idea of some of the data that's in these registries, I'm going to share 2 core data points. One is gross motor function classification system. So if you look here, this is from the clinical registry from November of 2021, when it had about 5,200 people, and you see a distribution in a U shape. It's not intended to be a population surveillance, so it looks a little different than what you'd see from CDC data. It reflects who comes to the clinic to be seen in a CP clinic. And then on the right, we have an age distribution where you see a bell curve, but since we haven't laid out the x-axis evenly, it's clearly shifted to the left towards younger patients. About 22% of our clinical registry are adults that are seen in these tertiary care centers. If you compare that to the clinical registry, you see a very different distribution of GMFCS, which is probably reflective of who you find online. And so it tends to be have a selection bias for white, middle class women, GMFCS2. And then when you look at the age distribution, you see it leans far more heavily towards adults, because those are people engaged in sort of advocating for better outcomes for their lives. So those are the programs of the CP Research Network. You see in the upper left our research and quality team. We have our educational and health and well-being programs. And then in the lower right, that's a shot from our meeting that we ran in Chicago in 2017, where we brought together 45 members of the community and the clinical care and research field to set our patient-centered agenda. So the CP Research Network is a 30-center learning health network that's spread across North America. So if you look at this map, you can see green pins are sites that are actively collecting data into the registry. Yellow pins are sites that are working on preparing the registry from a technology perspective. Red pins are sites working on compliance. And then the blue pins are sites that have raised their hand and said, we want to join the network, but they haven't gotten fully through the process yet of joining. So the way this works when they do join is we create a learning health system within each site. And so that starts with us providing them with our note templates and forms and working with their EMR analysts to take, so think of the gray box as being, one whole site. And what that allows them to do is in their process of usual care to capture patient characteristics, measures and scales, treatments and outcomes, all in discrete data in their EMR. And then what we're able to do is move that into our CPRN registry and use the collective information to help provide care data. So it can provide the basis for research, for quality improvement, knowledge translation, and the implementation of standards of care. So one quality improvement effort we have is implementing hip surveillance, which is critical in cerebral palsy, following the AACPDM care pathway, and we can track outcomes in this through our registry as a matter of the process. So the learning health systems come together in the form of the learning health network by sharing that individual site data together with the other sites and collecting the data into our registry at the University of Pittsburgh. And this provides an incredibly powerful platform for both research and quality improvement. This is our research pipeline. So on the left, we have our funnel where concepts are developed by investigators, encouraged to involve community members. The white ovals are research studies. The green ovals are quality improvement efforts. 4 of these are active right now inside the network. And we use these then to improve care, to generate knowledge, and then take that information and roll it into our forms so that we can then track, implement standards of care, implement evidence, and track outcomes over time. So in conclusion, the CP Research Network's unique value is that we connect the EMR to avoid duplicate data entry to create a registry. And by using our community registry, we're able to link PROs, patient-reported outcomes, to clinically validated data. And this provides a platform for sustained research efforts and quality improvement. And it also enables the study of outcomes over the long term through the use of our registries. And it really implements a learning health network for cerebral palsy. Thank you very much.